Hi, my name is Ariane Demers. I'm a second-year grad student here at Texas Lutheran University, and today I'm going to be talking to you guys about antifungal medications. Before I kind of get into antifungal medications, let's kind of go back and what actually causes a fungal infection to occur. Basically, a fungal infection, it's just an infection on the epidermis of the skin. This can either be through direct or indirect contact. Typically in the clinic, some of the most common types of fungal infections that we'll see is tinea capitis, which is basically just ringworm on the scalp, tinea pedis, which is athlete's foot, and tinea versicolor, which is just basically discoloration of the skin due to a fungal infection. So, for example, if we had a patient who came into our clinic complaining of itching and a little bit of scabbing on his foot, sometimes we diagnose him with athlete's foot or tinea pedis. So for this case or scenario, we're going to be using athlete's foot. So after they would come to us and we would diagnose them with athlete's foot, we would then kind of set up a treatment plan. And one of our treatment plans would be to get them on some type of antifungal cream. So some of the most common antifungal cream that you'll see is tolnafenate, terbinafine, and clotrimazole. So for this scenario, we're going to be using clotrimazole. So exactly why are we using clotrimazole to treat this patient's athlete's foot? Basically, clotrimazole just alters the cell membrane permeability, so it pretty much just prevents the growth of the fungus just to keep spreading. So it just kind of stops and it doesn't really spread anymore, and it just kind of dies off from then on. So the big question that a lot of athletes typically ask us when we kind of tell them, hey, you should get this medication, is can I still play? Can I return to participation? Can I still play my sport? And the really big answer is yes, you can still play your sport. These antifungals typically don't interfere with the patient's or the athlete's participation in their sport or active daily living or whatever they want to do. This is just kind of a supplementation to their treatment plan. So obviously when we talk about medications, there's always going to be some type of side effect occurring. So some of the most common side effects with clotrimazole or kind of most antifungal creams is you're going to have some irritation on the skin, some burning, some erythema or kind of like warmness on the skin, some edema or kind of swelling a little bit of the area that you put it on, and possibly if the patient has some sort of hypersensitivity to the drug itself, they might experience of hives where they kind of place the cream on her possibly. Now these don't occur every single time someone uses this, but these are just something that you should tell the patient, hey, just kind of look out for these, and if these do occur, hey, let's just kind of switch you on a different medication and see how you react from there. So with our treatment plan, not only are we going to have antifungal creams to supplement our treatment plan, but we're also going to be telling the patient, hey, make sure you're constantly kind of changing socks. If you're just kind of going throughout the same day and you keep sweating throughout the day with the same pair of socks, make sure you just kind of change them in and out. Proper hygiene is a big one, especially when the treatment of fungal infections occur. Make sure you keep proper hygiene. But the reason why we kind of use antifungal creams in the treatment of this is because 1, it's over the counter, 2, it's pretty inexpensive, and 3, it's very effective. So not only for their accessibility of this medication, but for us as clinicians, knowing that they are able to have the accessibility to this medication, and for them knowing that this is not going to cost them a week's worth of practices or they're going to miss out or anything like that. It's kind of a win-win situation when you're looking at antifungal creams. So they're pretty good to use when you're looking at fungal infections. So this was a quick little summary of antifungal medications and a quick little scenario as well. So I hope you enjoyed it, and thank you very much.